السلام عليكم ورحمة الله. اليوم عندنا تقرير بعنوان Tempromandibular joint. First of all, introduction. Tempromandibular joint is the joint that connects the mandible to the skull. The joint can be found on the both sides of the head in front of the ears. It allows the jaw to open and close, enabling the ability to speech and mastication. It is a synovial joint. What are the articular surface involved? The articular surface involved are the condyle of the mandible, which is the head, and the articular tubercle. And we have another structure in the T.M.J, which are the fibrous capsule, which is a loose attached to the margin of the articular area on temporal bone and around neck of mandible. And we have the articular disc, which divide the joint into two separate compartments. It is fibrous plate, and we have also the upper compart and lower compart. Upper compart permit gliding movement of the protrusions and the retrusions, and the lower compart permit depression and elevation, which is used to gliding and rotatory also. And we have the ligament of the joint. The ligament of the T.M.J is three ligaments, which are the lateral ligament, the tempromandibular, which is straighten the T.M.J laterally and prevent post-dislocation of the joint, and extend from the root of the zygomatic arch, and it attached to the posterior lateral aspect of the neck of the mandible. Stylomandibular ligament. Stylomandibular ligament is a thickened part of the deep fascia and separates the parotid from the submandibular gland. It attached to the lateral surface of the styloid process and to the angle of the mandible. And third and last, we have the sphenomandibular ligament, which is run from the spine of the sphenoid to the lingula of the mandible, as shown in this figure below. What are the muscles that produce the movement of the mandible are the T.M.J. They are the movement we have four movement, which is depression, which open the mouth, and elevation and protrusion and retrusion. The depression is mainly by gravity, and we have the muscle involved are the suprahyoid and the infrahyoid muscles, and the digastric and the myhyoid and the gynoid and the lateral tragoid muscle. On the elevation, which is the closing of the mouth, we have the temporal muscle and the masseter muscle and medial tragoid on both sides. And the protrusions, which is protraction of the chin, which is the lateral tragoid muscle involved, and the medial tragoid muscle also involved, and the masseter superficial, and that is the protrusion. We have also the retrusion, which is the traction of the jaw. We have the temporal muscle, and we have also the masseter. Relation of the T.M. joint. We have a several structure in the near of the T.M.J, which are, we have laterally the skin and the fascia and the parotid gland and the temporal branch of the facial nerve. And we also have on the medial side, we have the tympanic plate, which separates the joint from the internal carotid artery, and we have the spine of the sphenoid and the sphenomandibular ligament, and also we have the middle meningeal artery. On the anterior side, we have the lateral tragoid muscle and the masteric nerve and vessels, and posteriorly we have the parotid separate joint from the external auditory, and also we have the superficial temporal vessels and the auriculotemporal vessels. Superiorly, we have the middle cranial fossa, and we have the middle meningeal vessels, and inferiorly we have the maxillary artery and nerve, as shown in the figure. The blood supply of the joint. The blood supply of the joint is mainly by the maxillary artery and the superficial temporal artery, And we have also nerve that supply the joint, which are the oculotemporal nerve and the masteric nerve. Now we moved into the another subject which is the T.M.J clinical notes and disorders. We have the clinical significance of the T.M.J. The temporomandibular joint lies immediately in front of the external auditory meatus. The great strength of the lateral temporomandibular ligament prevents the head of the mandible from facing backward and fracturing the tympanic plate when a severe blow falls on the chin. The articular disc of the temporomandibular joint may become partially detached from the capsule, and this results in the movement becoming noisy and produce an audible click during movement of the joint. So when open and closing of the joint, we have here a click, sound like a click. We have several cases of the TMJ. The first of all is the dislocation of the temporomandibular joint. Dislocations occur when the mandible is depressed. The movement, uh, head of the mandible and the articular disc move forward until they reach their summit of the articular tubercle, and in this position, the joint is unstable, and a minor blow on the chin or accident contracts of the lateral trigger muscle as yawning may be sufficient to pull the disc forward beyond the summit, so it has a dislocation. And in bilateral cases, the mouth is fixed in an opening position, and both heads of the mouth to lie in front of the particular tubercle, as shown in the figure. And the reduction of the dislocation is easily achieved by pressing on the glove thumbs down wound on the lower molar and then pushing the jaw backward. The downward pressure become the tension of the temporalis and overcome the tension of the temporalis and the masseter muscles, and the backward pressure overcome the spasm of the lateral tragoid muscle, so it click right back in, as shown in this figure, which the doctor put his thumbs in the molars and pushed downward and backward until he heard the click back in. We have the T.M.J disorders. The T.M.J disorders classified into various cases in the following systematic classification for diagnosis. The temporomandibular joint disorders, we have first of all the masticatory muscle disorder, certainly the most frequent complaint given by patients with functional disturbance of the masticatory system and muscle pain, which is myalgia. A patient commonly report that the pain is associated with functional activities such as chewing, swallowing, and speaking. The pain is aggressive uh, by manual palpation or functional manipulation of the muscle. Restricted mandibular movement is common, and muscle pain is extracapsular origin to be primarily induced by the inhibitory effect of the deep muscle itself. So sometimes accompanying these muscle systems is an acute malocclusion. So this case is usually associated with a severe malocclusion. Typically, the patient will report that hit or her bite has changed. As previously stated, muscle pain disorder can alter the result, the mandibular position, that when the teeth are brought into contact, the patient perceives a change in the occlusion. All muscular muscle disorders are not clinically the same. At least there are 5 different types are known, and be able to distinguish among them is important because the treatment for each one is quite different, and the different type of protective co-contraction, which is muscle splinting, and local myalgia, and the myofascial pain and myospasm, and certainly mediated myalgia. A sixth condition known as fibromyalgia also need to be discussed. The first three conditions, which are the protective co-contraction and the local myalgia and the myofascial pain, are commonly seen in the dental office. So we should also focus on them. Myospasm and certainly um, mediated myalgia are less frequency, and since most of these muscular muscle disorders occur and recover in a relatively short period of time, they are generally considered acute myalgia disorders. When these conditions are not resolved, they have more chronic pain disorders may result, which are often more complicated to manage, and certainly uh, mediate myalgia and fibromyalgia are example of chronic myalgia disorders. In some patients, myofascial pain can also become chronic. We have in this figure a woman which is experiencing a spasm in the right inferior lateral trigger muscle. The spasm activity is very painful and forces her jaw into an extreme left lateral movement. So we have the malocclusion. And the second subject is the temporomandibular joint disorder. We have the T.M.J have their chief symptoms and dysfunction associated with the altered condyle disc function. Uh, Neuralgia is often reported, but dysfunction is more common. Finding dysfunction systems are associated with condylar movement and reported as sensation of clicking and catching the joint. They are usually constant and repeatable and sometimes progressive. The presence of pain is not reliably finding. The TMJ disorder can be subdivided into three major categories: the dearrangement of the condyle disc complex and the structure. Another classification of the systematic disorders is the chronic mandibular hypomobility, which is the chronic mandibular hypomobility is a long-term painless restriction of the mandible. Pain is elected only when the force is used to attempt opening beyond the limitation, and the condition can be classified according to the etiology as ankylosis and muscle contracting and choroid process impedance. And we have the last factor, systematic factor, which is the growth disorders. The growth disorders are the TMJ resulting from growth disturbance, may be due to a variety of etiologies. The growth disturbance may be in the bones or the muscles. Common growth disturbance of the bone are agenesis, which is no growth, and hypoplasia, which is insufficient growth, and hyperplasia, which is too much growth, or neoplasia, which is uncontrolled destructive growth. Common growth disturbance of the muscles are hypertrophy, which is weakened muscle, and hypertrophy, which is increased size and strength of the muscle, and neoplasia, which is uncontrolled destructive growth. Uh, Here we finish the systematic classification of the disorders of the TMJ, and we will discuss another subject, which is the inflammation of the joint disorders. The inflammatory disorders of the TMJ are characterized by the continuous deep pain and usually accented by function, associated by function. Since the pain is continuous, it can produce secondary central excitatory effect. These usually appear as referred pain, excessive and sensitivity to touch, and the increased protective co-contraction. Inflammatory joint disorders are classified according to the structure involved, which is synovitis and capsulitis and retrodiscitis and the arthritis. Severe associated structure can be also be inflated. Synovitis and capsulitis as inflammation of the synovial tissue, which is synovitis, and of the capsule ligament, which is capsulitis, and the present clinically as one disorder. Thus, a differential diagnosis is very difficult. The only way to be differentiated is using the orthoscopy. Since treatment for each is identical, it becomes little more than academic to separate from the two conditions. Etiology, synovitis and the capsulitis usually follow the trauma to the tissue, such as the macrotrauma, which is below the chin, or the micro trauma, a slow impingement on these tissue by an anterior displacement of the disc. Trauma may be also rise from wide open mouth seizures or abusive movement. Sometimes inflammatory may spread from the adjacent spread from the structure to the adjacent area. Summary. In the summary of this report, we have a classification to aid in the identification and diagnosis of the TMD has been presented, and it does not include all the disorders cause pain and dysfunction of the head and the neck. Diseases of vascular origins, such as like arthritis or marginal headaches, are a neural origin like neuralgia and neuropathies have not been included. Likewise, the cranocervical disorders as well ear and eye disorders have not been addressed. This classification is useful, however, to identify the common function disturbance of the masticatory system that fall within the context of this report. When the patient problem does not fit into one of these categories, you have to make more extensive examination procedures uh, which are indicated. And thank